Hello. The purpose of this presentation is to give businesses and employers information and resources on COVID-19. The following topics will be covered in this presentation: reducing transmission among employees, maintaining healthy business operations, maintaining a healthy work environment, public health monitoring, and updates or resources for COVID-19. We are going to talk about reducing transmission among employees. The best way to prevent infection is to avoid being exposed to COVID-19. CDC and the Department of Health always recommend these actions to help prevent the spread of respiratory viruses, including ensuring your employees are safe. Wash your hands, often with soap and water, for at least 20 seconds, especially after going to the bathroom, before eating, blowing your nose, coughing, and/or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Also, wash or use hand sanitizer upon entering and leaving a room with a door handle. Avoid touching eyes, nose, and your mouth with unwashed hands. Avoid close contact with people who are sick, and stay home if you are sick. Cover coughs or sneezes with a tissue, and then throw that tissue in the trash. Clean and disinfect frequently touched objects and surfaces. Symptoms of COVID-19 are fever, cough, shortness of breath, along with other symptoms. Symptoms may appear in as few as 2 days or as many as 14 following exposure. Most people recover from COVID-19 without needing special treatment. Symptoms may range from mild to severe. Employees who have symptoms should notify their supervisor and stay home, keep in touch with their doctor, and self-isolate from others. Employees should not return to work for at least 3 days or 72 hours have passed since recovery defined as a resolution of fever without the use of fever-reducing medications and complete improvement in respiratory symptoms, and at least 7 days have passed since symptoms have first appeared. Worker risk of occupational exposure to SARS-CoV, the virus that causes COVID-19, during an outbreak may vary from very high to medium or lower. The level of risk depends in part on the industry type. Businesses under the very high-risk category are healthcare workers, lab personnel, and morgue workers. High-risk category includes healthcare delivery and support staff, medical transport workers, and mortuary workers. Businesses under the medium-risk category include high population density work environments, some high-volume grocery and retail settings, and businesses under the lower risk category have minimal occupational contact with the public or other co-workers. Grocery and retail stores falling under the medium risk category should implement the following practices as appropriate. Installing physical barriers, such as a clear plastic sneeze guard, if feasible. Keep customers informed about symptoms of COVID-19 and ask sick customers to minimize contact with coworkers until healthy again. Post signs about COVID-19 in stores where customers may visit, such as pharmacies, and include COVID-19 information in messages sent when prescriptions are ready for pickup. Where appropriate, limit customers and the public access to a work site, or restrict access to only certain areas. Workers with medium exposure may need to wear a combination of gloves, a gown, a face mask, or a face shield, or goggles. Personal protective equipment ensembles for workers in the medium exposure risk category will vary by work task and the types of exposures workers have on the job. We will continue with maintaining healthy business operations. Identify a workplace coordinator who will be responsible for COVID-19 issues and their impact at the workplace. Ensure that sick leave policies are flexible and consistent with public health guidance and that employees are aware of and understand these policies. Employers should not require a positive COVID-19 test result or a healthcare provider note for employees who are sick to validate illness. Healthcare provider offices and medical facilities may be extremely busy and not able to provide such documentation in a timely manner. Connect employees to Employee Assistance Program resources if those are available, as well as community resources as needed. Furthermore, be prepared to change your business practices if needed to maintain critical operations. You may need to prioritize existing customers, identify suppliers, or temporarily suspend operations as necessary. We will continue with maintaining a healthy work environment. Improving controls may include one or both of the following activities. Increase ventilation rates. Increase the percentage of outdoor air that circulates into the system. Direct employees to practice proper coughing, sneezing, and hand hygiene etiquette. Provide tissues and no-touch disposal receptacles for workers and customers. Continue to provide soap and water in the workplace, and place hand sanitizer in multiple locations to encourage hand hygiene. Place posters that encourage hand hygiene to stop the spread at the entrance to your workplace and to other areas where they are likely to be seen, and discourage handshaking. Routinely clean and disinfect all touch surfaces in the workplace. This includes workstations, checkouts, counters, keyboards, telephones, handrails, light switches, and doorknobs. Providing disposable wipes so that commonly used surfaces can be wiped down by employees after each use. Also, carefully consider whether travel or in-person meetings are necessary. Continue using video conferencing or teleconferencing. Public health monitoring. The Florida Department of Health has taken on many duties to ensure Floridians are protected from emerging public health threats. All health departments are interconnected and are in constant communication with each other to combat this virus. We have direct communication to and from the CDC regarding new cases and U.S. citizens returning from potential travel. Travelers are told to self-isolate and are tracked by the Florida Department of Health for symptoms. For a real-time, interactive map displaying all COVID-19 cases in Florida and the rest of the world, please check out the link that is on this slide. For updates and resources. General questions regarding COVID-19, please call 866-779-6121. This phone number is available 24 hours a day, 7 days a week. You can also email covid-19@flhealth.gov. If you are experiencing symptoms, contact your healthcare provider or DOH Collier at area code 239-252-6220. This call center is available 7 days a week from 9 a.m. to 5 p.m. For additional business resources, visit the Center for Disease Control website under the Business tab, or visit the OSHA website for guidance on workplaces. For world updates, visit the World Health Organization's website, and for United States updates, visit the CDC or Center for Disease Control website. These websites provide information and alerts during this ever-changing situation. For state updates and local updates, contact the Florida Department of Health website. For county updates, visit the Collier County government website. The Collier County government website updates their website with county closures and cancellations under the news release section. Thank you. Stay healthy.